Hi, my name is Sam James, and thank you for taking interest in our paper titled Chronic Care and a Life Transition Challenges and Opportunities for Artificial Intelligence to Support Young Adults with Type 1 Diabetes Moving to University. People's lives regularly change in many different ways. Some of these changes form major life transitions, moving home, starting a new job, or moving to another stage of education, for example. These transitions have a major impact on a person's life and disrupt routines built up in the previous situation. This disruption causes difficulties for everyone, but people living with a chronic condition face additional burden as they are often reliant on management strategies that become no longer relevant. They also face new scenarios they haven't yet developed strategies for and have to adapt to these challenges while many of the changes are vying for attention. Now, type 1 diabetes is an example of a chronic condition that requires consistent management to avoid adverse impacts on a person's health. Those with type 1 diabetes are unable to regulate their blood glucose levels naturally, so must monitor it and inject insulin to manage it themselves. It also has benefited from many recent advances in management technology, with more on the verge of completion. This rise in data and artificial intelligence based technology means it forms a useful case study to understand the impact of a life transition on chronic condition management and also where technology's role comes in reducing that impact. Young adulthood is a period of life where transitions are more likely to occur. This is because independence is being gained from parents, and people are often finishing school, which opens new opportunities and options for life direction. One example of this, which will be the focus of this work, is the move to university. This life transition commonly brings with it changes to location, people, and schedule, and often forms a less consistent lifestyle. Additionally, in the UK, young adults are an age group that has the lowest proportion of people meeting type 1 diabetes management targets, making it particularly relevant for focus. To explore the experiences of managing a chronic condition and life transition, an interview study was completed with 24 young adults living in the UK with type 1 diabetes who left their child at home in the last 5 years. While the study aimed to include people who had left home for a range of reasons, all the participants ended up having done so to go to university. In the UK, roughly 50% of people attend university by the age of 30. So this group is still relevant to a significant proportion of the population, but we accept that it will add bias in due to the socio-economic profile of university attendees. The interviews lasted for up to an hour and covered a range of topics about the participants' life before and after the move and their process of adapting it with consideration for the technology used to do so. These interviews were then transcribed and thematically analysed. And during this process of thematic analysis, links were drawn to the sense-making activities outlined by Mamakina et al. In their work on sense-making in chronic condition management. As a result, each of the sub-themes was separated into three the activities. And these activities were the perception of new information in the initial disruption, development of inferences from the perceptions during the transition, and putting the inferences into practice as part of self-management. Now, the findings were split into two core groups, and these themes were the changes to lifestyle and changes to support network. The changes to lifestyle encapsulated drinking, eating, sleeping, and physical activity habits, as well as changes to routine and schedule. In each of these areas, participants experienced changes as part of moving to university, and these often negatively impacted blood glucose management. While there were underlying management strategies that the participant had learned over the years, these needed to be adapted to the new situation. One of the more interesting changes to lifestyle was around the consumption of alcohol, which in the UK is ingrained into university culture. Alcohol has a delayed impact on blood glucose, while drinks often have a lot of sugar in, which have an immediate impact on blood glucose. These combine to create a challenging management scenario, added to by the negative effect alcohol has on cognitive function. Participants were aware of this impact, but still wanted to fit in and experience drinking at university. In Freshers Week, the first week of university, heavy drinking is common, and trying to adjust management strategies comes with additional difficulties under the influence of alcohol. The move to university often means leaving your friends and parents behind and then having to learn to fend for yourself. This came as a stark realization to some participants who recognized the sudden loss of support and help at times things went wrong. For many, the day-to-day management was easy enough to adapt to, as they'd already been managing independently before the move. However, the additional responsibility for managing hospital appointments, prescriptions, and medical supplies came as a shock and often was found to be the most difficult element to adapt to. Participants found that at university there were few people who really had an understanding of type 1 diabetes. So, to gain support from those around them, they needed to explain the condition. There was reasonable variation in participants' approach to doing this, with some avoiding it altogether and others carefully deliberating over who was likely to become a friend and then providing them the information. In most cases, this caused apprehension, but those who did talk to others about it were rarely met with resistance other than from misunderstandings about the condition. However, the role others took in management was less at university than it had been at home, and there was generally less trust in the ability of those around them. Over time at university, this did shift a little more, and more support came from others as they kind of spent more time around the young adults and gained a deeper understanding of the condition. The findings outline several challenges that the move to university presents for type 1 diabetes management. There is the potential for artificial intelligence to address some of these challenges, particularly as part of the closed loop system. Now, closed loop systems are devices that automate the type 1 diabetes management process, and they've been hailed as the future of diabetes management. They could help aid management during these life transitions by taking on some of the burden, leaving the young adults to spend more time considering other changes going on. These systems could be further improved through personalization of the algorithms, additional data streams, and profile switching. However, this also brings risks of overfitting to a situation. And then when the participant moves to university, the resulting algorithm is no longer performing as well. Also, a current limitation with the development is the lack of testing done or data available from people going through life transitions, making it difficult to develop technology aimed at this group, or at least considering this group. Conversely, some challenges are not so obviously solved by artificial intelligence. Knowing when to explain to someone what type 1 diabetes is, deciding how much access friends and parents should have to remote monitoring tools, and understanding when and how to manage medical appointments and prescriptions, for example. These tend to be more based in a social context, and here lies potential for human-centered design approaches to target the needs of individuals when developing tools and technology to support chronic condition management in a life transition. Thank you very much for listening. If you have any questions or points, please come and find me at CHI 2023. I'm really keen to discuss these ideas further and hear other perspectives people have.